to today's virtual talk show on one of the most important topics in healthcare, cancer prevention and screening. My name is Pratima Penumarti, and I'm the founder and president of Volunteering for Seniors organization. We are excited to have you join us for this insightful session, which aims to provide valuable information about how we can protect ourselves and our loved ones through early detection and prevention. As we all know, cancer continues to be one of the leading health challenges worldwide, but thanks to medical advancements, early screenings and prevention can significantly reduce the risk and improve outcomes from many types of cancers. Today's session is all about empowering you with knowledge and addressing any concerns you might have about cancer screening so you can make informed decisions. So the goal of this talk show is to raise awareness about the importance of cancer screenings, focusing on common screenings like breast, lung, and colon cancer, and to encourage people to schedule routine screenings for early detection. Also, today's interview aims to give a comprehensive view of cancer prevention by raising awareness about screenings, even addressing common myths, discussing new technologies that are changing the field. Now, it's my distinct honor to introduce our esteemed speaker for today's session, Dr. Ravi Vissapragada, who is not only an accomplished surgeon, but also a passionate advocate for health economics, bringing a unique blend of clinical expertise and strategic insight to the field. We are privileged to have him with us today to share his valuable knowledge. Dr. Ravi has been instrumental in raising awareness about the importance of cancer screening, and today he will share insights on the latest screening guidelines, advancements in technology, and what steps we all can take to reduce our cancer risk. Please join me in welcoming Dr. Ravi Vissapragada. Dr. Ravi, thank you very much for being with us today, and we are eager to hear your expertise on this topic. So I will turn it over to you to begin.
Thank you. The very nice introduction. Yes, cancer screening and prevention is, a point of exercise in the U.S., especially now, because a lot of the baby boomer generation, the health awareness was probably less so than it is now. So that means that there's a lot of diseases, including cancer, that they're at risk for, particularly with environmental, pollutants and carcinogens that we did not know about. That includes medications that perhaps hospitals used to use, water-related sanitation, and a number of other things, housing materials, etc. So cancer screening is aimed at reducing the number of risk factors, firstly. So that's what cancer prevention starts with. And then secondly, about which cancers can be detected at an early stage. And the main reason for that is that the survival from cancer depends, on many factors, but the largest is the earlier it is detected, the less invasive the options are, and the higher the survival. So, in the U.S., currently there's several screening programs that people generally get screened for. The main ones, as you mentioned, is colorectal cancer, breast cancer, prostate, lung, and cervical cancer. So those are the main ones that are currently offered through a screening program. There's other things that people will screen for if you have a high risk of it, so such as family history of gastric cancer or esophageal cancer or liver cancer as well, or if you've had something that is a precursor to those cancers. But the main ones are those 5 that I just mentioned. And in terms of who should get screening, it's really depends on two factors. One is your risk factor profile and also your age. So risk factor profile is about what predisposes you to that particular type of cancer. So if you're male, then you are more predisposed to prostate cancer. And currently, the prostate cancer can be checked with a test called the PSA, which is the prostatic specific antigen, and that starts somewhere around the age of 60. So after about age 55, you can get checked for prostate cancer. If you're female, then breast cancer is the most common cancer, and this means that you should have mammograms starting at the age of 50 if you don't have any high risk factors. And high risk factors means you have a family history of it. And when there's a family history of it, then you start screening about 5 years before the diagnosis of cancer was made in your family member. And these mammograms are generally done every 2 years between the ages of 50 and 74, or if an earlier age, if that's if you have a high risk factor. The
So,
next, yeah,
so Ravi, I just wanted to interrupt you here because just before even jumping into screening, I have a question with respect to cancer prevention.
yeah,
Uh,
yeah.
there's a couple of questions I have. What do you think are the top lifestyle changes that people need to make to lower their cancer risk?
That's a good question. So first of all, it depends on, what age you are. So if you're at 20 years old, there's things that if you do that will significantly reduce the risk of cancer. But if you're already above the age of 65 or 70, it may not be as useful because cancer has a latency period, so it's usually growing in the background for several years before it appears. So it starts off with a few cells which are microscopic, and then it multiplies, and then by the time it's detected on any imaging, it's usually already quite advanced. And that's the case for most cancers. Some cancers are just less aggressive than others and have a better overall survival. But in general, that's how um, cancers progress. So if you are, regardless of all those, it's still best to then reduce the risk factors. And the number one risk factor for all cancers is smoking. So smoking cessation is very, very important. And that's for two reasons. One is obviously reducing the risk of cancer. But even if you do get cancer and you have quit smoking or you don't smoke, that increases your chance of survival because you will not have issues with post-operative recovery or post treatment recovery, whether you're getting chemotherapy or radiotherapy or surgery. Your lung status and your functional status due to smoking and your heart status is all affected by the amount you smoke. So it is absolutely critical that you don't smoke. And these include all types of nicotine products. So even if you just have nicotine, consumption, you can still be at risk for cardiovascular diseases, issues with your leg arteries and brain arteries as well. So all these are affected when you smoke. The second thing is alcohol consumption. So alcohol is also known to have a reduces the immune capacity as well as causes changes within cells that are make it more prone to cancer progression. So it's absolutely critical that, alcohol consumption is, at a mild or even moderate consumption at max. So heavy consumption, daily consumption, for example, is, likely going to increase your chances. In addition, alcohol makes a lot of other organ systems much worse also. So it's really, really healthy to just get that under control early on. Other than that, a healthy, balanced diet can be quite helpful. This includes sort of fiber-rich diet with reducing the amount of meats that you eat. Particular things like whole grains are really good, and reducing fat consumption and sugar consumption. So there's certain types of fats that can be good, but in general, they're linked to increasing cardiovascular diseases, and the healthy fats can be found in certain types of foods, like nuts and and antioxidants as well. So if you take, fruits and antioxidant pills, then that can reduce the chance that you may get cancer.
So,
And the last thing is exercise. So I think that, if you whether you have a risk of cancer or not, exercise can improve your ability to fight any types of disease. So it improves the immune system, it improves the mental health, and it improves your heart, lungs, and everything.
there's one of the question which comes, which has been asked by some of the people, right? Even seniors and pre-seniors. Like, as a surgeon, what are your thoughts on preventive measures? Like, there are certain vaccines, right?
Mhm.
For example, just whatever, you feel convenient. For example, the HPV vaccine. So are they anyway good when it comes to the preventive measures?
Absolutely. HPV is quite common nowadays. It's probably estimated about 45 to 50% of us are HPV carriers, and it's linked to a number of cancers. So cervical cancer in women is the main one. So women with HPV can take the vaccine to reduce the risk of cancer. It does work better if you're younger and you take the vaccine, but at the same time, it doesn't hurt to take it later in life. I would, however, just get tested first and ensure that you already don't have a type of cancer that you're trying to prevent. So cervical cancer has a screening program as well. And it also reduces chances of what we call squamous cell cancer of various parts of the body. And head and neck cancer, for example, is heavily linked to smoking and HPV, as well as esophageal squamous cell cancer is also linked to HPV and heavy smoking. So I think you know, it's not a bad idea to get the vaccine, both whether you're male or female.
There was a question that's a very good answer for when it comes to prevention part of it. But coming to the screenings, Dr. Ravi, I have a question like, um, how do these screening guidelines differ for people at high risk? It is like due to family history or genetic predisposition.
Yeah, so it depends on what type of cancer it is. Some cancers are more genetically linked, and there's a high chance that you'll get it. For example, if you take colorectal cancer, so there's certain types of individuals that have a very high risk of developing colorectal cancer. And these individuals will develop colorectal cancer much earlier. We see patients more and more even these days that are getting colorectal cancer under the age of 40. In fact, this week we operated on a lady that was born in 1981. So she's about 30, how much is it? 43 years old or so. And she had three cancers in her colon, which required taking out the entirety of her colon. So individuals who develop cancer this early generally have a genetic mutation that is passed on through their parents. And this means that her children will need to be screened much earlier to ensure that they don't have cancers. And in fact, to some patients, we offer them to take out their entire colon even before they develop cancer because of how sure we are that they will eventually. The same applies for stomach cancers. Certain patients who develop stomach cancer, when we test them genetically, they will show that they carry a gene or have a gene that will like maybe more than 75% chance that they will get cancer. So their children probably about 50% chance of getting cancer. And in a lot of these very highly aggressive cancers, we offer them surgery even before they develop it because of how bad it can be if the cancer comes and then we have to treat it. So it's dependent on what type of cancer. It depends on your genetic profile. It depends on the genetic profile of the family member who has the cancer as well. And that's what makes the decision of one, do we do an earlier screening? So there's patients that will screen from basically as soon as they're adolescents, and they will get colonoscopies or endoscopies from a very early age, and they will be offered something by the age of 18 in certain rare circumstances to have the surgery if that's the case. Breast cancer is also another one of those. So there's certain genetic mutations that we offer prophylactic surgery for, which is quite difficult, as you might imagine. But it's to ensure that you don't carry the tissue that can develop the cancer, and that you then have a longer survival and better quality of life, even if that means that you have to, get inconvenienced at an earlier stage in your life.
I have a question here, Dr. Ravi, is that can you explain? I mean, of course, most of the people know about screening tools like mammograms and colonoscopies, but there are people who are still confused when it comes to colonoscopies and the newer tests like liquid biopsy. So what is that? Could you please explain that?
So the tests that the U.S. Task Force for Prevention of Cancers does is so that everyone can go get a standardized test and they can develop a screening program. There are more than one tests available to test for cancer. In previous years, we used to hear that, whole body MRIs, and whole body CT scans, et cetera, et cetera. And there's obviously blood tests that you can get as well. The recommendations that are on the U.S. Task Force for Prevention of Cancers is based on what is the gold standard test for these cancers. So colonoscopy is the gold standard test in the US for screening of cancers. It's different in different countries, obviously. In Australia, we don't do colonoscopies for everyone. We do colonoscopies for patients who, after they take a stool test, if they're positive for the stool test, then they come back and get the colonoscopies. But some of that has to do with resources, because the resources in Australia, like the colonoscopies, are paid for by the public health, and they have to manage how much money they put into screening tests and screening programs. In the US, the claim has always been that colonoscopy is still the best screening test, and that's true. If you took a series of 1,000 patients and you gave them a colonoscopy and then you gave them a stool test, the colonoscopy patients would have a much higher rate of accuracy in detecting any cancers versus someone who has a stool test. The main reason being that blood in stool, it can be detected in other conditions as well, not just cancer. Um, so yeah, it depends on what type of cancer you're looking for, but generally speaking, the gold standard for most of these cancers will be doing the test that allows you to get a biopsy of that test of that cancer.
So those are called liquid biopsies, right? Those are newer tests, they said something like, which I never heard before, like liquid biopsies.
I don't think so. The tissue biopsy is probably what's the best one to do at this moment. In the future, once we have enough data, then we could see whether the liquid biopsies or other things can be done. There's several tests on the horizon, such as the liquid biopsy. There's capsules that you can swallow and then you can take out as well, and that contains cancer cells of the stomach and the esophagus. There's various other imaging things that are coming up as well, but I don't think there's enough data to say that they're better than the gold standard currently.
I see.
Well, that's always going to continue getting developed.
True. Coming to the current trends and screenings and early detection, has or how has COVID-19 impacted the cancer screenings? And what should people of all ages, I mean, it need not be just the seniors, but even people in early 40s do if they missed a screening?
Um, so if you miss a screening, then just go and get it done the earliest time possible. Is probably the best thing to do. Um, it's not like a window of opportunity that if you miss, then you are too late. You can still get screened at a later stage. And if you are found to have something, then you can just get treated for it. Now, if you've missed it and you actually have cancer, it
Mhm.
will impact you somewhat, but at the same time, you're still better off getting it done and detecting it at the present than, missing it completely.
That's true, because in US, I mean, they expect us to do most of the screenings like mammogram, the pap test. Pap tests are done every 5 years, but I think mammogram
Yeah,
has to be every year.
yeah,
Respect of the age, they started from 45 years here, to start that.
yeah, yeah.
There are certain myths which needs to be debunked. What are the common misconceptions, right? Misconceptions about cancer prevention and screenings that you would like to clear up if there is something?
Um, there's probably a lot of things that I hear about, but there's probably a lot of things that I don't hear about because, patients usually say, I Googled this or something like that. I think the problem with cancer is that it has a lot of it creates a lot of anxiety. So um, there's some people that there's both sides of the spectrum. There's some people that are very anxious about getting cancer or having a diagnosis of cancer, and equally there's people that don't care even if they have it. They just don't want to know. They are afraid to, they're in denial and they're afraid to sort of admit it. And whenever we approach a patient, we get a sense of where on that spectrum they lie, because you have to tailor the information to the patient's ability to perceive it. So if someone is very scared of cancer, there's a certain amount of reassurance that we have to give. Whereas someone who, probably has the risk factors and doesn't want to get, screened or tested, you have to be a little bit more persuasive in getting them to do the appropriate tests. The myths that surround cancer prevention, etc. There is no one risk factor or one thing that you can do to get cancer. Cancer is a combination of risk factors and combination of your genetics. Even the ones that are heavily linked to a certain thing, there is something in your genetic profile that makes you more prone to cancer. And this could be related to, like family history, or it could just be related to your own genes that aren't that similar to either of your parents.
But I
Things
have a question. Yeah, which is you're right, Ravi. But I have a question. Correct me if I'm wrong. But do you think that, I don't know, this is something which I personally feel, but or it's also something which is sometimes being added upon by people from, the old school people, like overdiagnosis, or does it cause harm? Like any overdiagnosis or unnecessarily treatments can be wrong, but I'm just asking you, like.
Absolutely. And we see that in certain cancers like breast and thyroid. You know, in an older time, we would not have picked up a lot of these cancers.
Mhm.
With new age diagnostic modalities, we're able to now pick up even the tiniest of cancers. And some of these cancers may have never actually, an extent where it affected your chance of survival. How, chance of survival are now in the 80s and 90s. It's not uncommon to see patients who have reached, over 90
Mhm.
because of, all the healthcare progress we've made. So now the quality of life that is affected by cancer is great than, let's
Right.
say, about 200 years ago, where the median age of survival was probably 60s or 70s. People had other things that would affect their quality of life. So some of the overdiagnosis is, related to finding things that probably will not have caused them much issues. But
Mhm.
because if we find cancer, we are obligated to treat it, especially in someone who is going to survive, for a long time. And, some of these cancers, even if they don't cause harm, they now have an impact on the mental well-being of the patient because, you know, we say cancer state is something that never goes away. We don't call you cured of cancer. We say you're in remission.
Remission,
You know,
yes.
you're cured of an infection. You're cured of an accident. You're cured of many things, but you're never cured of cancer because there's always a small chance that it will come back. So that type of weight can make you quite anxious. And a survivor of cancer, may feel that anxiety for the rest of their lives because every time they find out another symptom, they may have a new headache and they might think, is a cancer back? They may have pain somewhere and they think, is my cancer back? So, it's really a protective mechanism for our bodies to say, let's relate any of our things to something so that we can get it tested and treated. That's a survival advantage that has helped humans, but it probably does go wrong in an era where we have so many imaging modalities and testing modalities available. Um,
Uh,
yeah.
Yeah, and when you, as an advice for the public, the general public, what would you advise people who are hesitant about getting screened, basically due to fear or misinformation? That's one part. Another one is that
Mm,
what role do you think even community education and outreach play in increasing cancer screening rates?
yeah. The advice I would have is that follow the advice of the screening programs. The screening programs are made by very highly intelligent and resourceful people that have made it their life's mission to study that one cancer. So a screening program isn't made by one person or a group of people. It's made by several groups of people that are have been studying that disease for a very long time. So they've been following every single research that comes out of it. They would have been doing a lot of the research that about that cancer, and they form these with the help of the government to be able to best you know, provide awareness and screen for the cancer. So following their advice is the best advice we can get on in this world. So any screening program that is available, I would highly recommend to sort of approach it. And if you fit the criteria for it, which is age, your sex, your family history, etc., then you should get screened. If you're on the other side where you feel nervous about getting a cancer, then you probably should approach a health professional, and um, they'll take a history, they'll do some blood tests, and they'll create a risk profile that will be able to say that yes, you should have screening earlier because of issue one, two, and three, or that you don't have the risk factor, so you can go in the general screening program. And if that's the case, then that's okay. And lastly, I would say that we are all bound to some laws on this, in this universe. Some of the laws are not fair, but we are bound to them. So whether you get cancer or not is unlikely to be, completely in your control. You can do everything that you can to reduce the chances of it, but if you do have it, it is something that, people can work on, like the doctors can help you, and you just have to take it one step at a time and go through it and just know that the best that can be done, it will be done if you just stick with it and don't let it take your sanity as well as your health.
Um, Moving from this section to just to medication and management part of it, because our organization, we have connection with many seniors. What do you think, or what are the common challenges that seniors face with managing multiple medications?
Yeah, unfortunately, with the advent of better and better medications and more pharmaceuticals trying to provide, different alternatives, the polypharmacy is quite a big issue in both the hospitals as well as in the community. Um, you know, eh, Several patients, after the age of 85, I'd be shocked if someone wasn't on at least 5 to 10 medications. And some of them include blood thinners that, is can have some side effects, especially if you're prone to falling down or injuring yourself. So it is an issue. It's a issue that needs a very particular and careful sort of consideration, because the medications are necessary, but having so many that you either forget to take them or you're poorly compliant,
Mhm.
or that over time the side effect profiles affect you negatively, or that in interactions between these medications over time can also cause effects. These are all things that have to be quite carefully managed. I think, though, we're reaching a time where all these interactions and side effects and all these things are improving with every year. The the drugs are much cleaner. So previously they used to use different materials that we probably we don't use today to make drugs because we've realized what kind of long-term effects that has. Even small side effects like nausea, some of the medications, the way they were constituted could induce nausea, etc. All these things we are more aware of them now than we ever were. But at the same time, it doesn't mean that the compliance is still an issue. Side effects from medications still exist. So it's just about being aware that you're taking more than a number of medications and that those have side effect profiles. That's the first thing, is knowing what kinds of things you need to watch out for. What is the biggest issue with like your medication? So what is the kind of thing that you need to seek medical expert opinion for? And what are some of the smaller issues that you can alleviate at home, for example? So if you're taking diabetic medications, then you should be aware of, obviously your blood glucose creeping up. That's obviously an issue. So you might be taking the same medication, but your diabetic status might be worsening. So you need to be aware of your blood glucose levels. But probably more importantly, you need to be worried about having a low. If you on one of the days don't consume the same amount that you would on other days, or you miss a meal, or you have some other complication that requires you to not have food, then you need to be aware that your medications that you might have already taken might make it too low. Similarly with blood pressure, most of the time you might be running high, but if you don't drink enough water, or if you're sick, you might have a low, and you're taking medications that suppress your body's ability to increase it sometimes. And same with heart medications. Heart medications sometimes slow down your heart, but that's not always great, because if you sometimes need your heart to beat faster to be able to compensate, but you're not able to, then that's going to make you faint or things like those. So knowing the critical side effects that you might have from medications is very important, and you can do a lot to try and minimize the damage that it causes by being aware and acting proactively seeking it, rather than after it happens, then you're a step behind.
Yeah, which is very true. So, Dr. Ravi, I have another question, is that could you share any memorable cases where early screenings have saved a life, or where misscreening led to more complex outcomes? And also, I wanted you, if you can, share your thoughts on future trends in cancer prevention, or is there any, as well as there any hopes for advancement in this field?
Yeah, there's certainly lots of times where we've done something that we suspect very slight chance that it could be cancer. For example, we had a patient come in with just some pain in the anus, and everyone, she was quite young, so we just assumed that it was probably just a tear in the anus. So we were treating it for that, and that requires for us to look when you're asleep and inject some medications. But we saw that there was a lesion in that area. And this can be normal because when you have issues with tearing of the anus muscles, it can create an ulcerative lesion in that area. And we decided to test it. And, unfortunately, she had quite a few risk factors for developing cancer of that area. And we found out that she did have cancer. It was a very tiny one. It's not something that we do surgery for. It just is about chemotherapy and radiotherapy. So, and it generally has a good prognosis. So that's quite helpful in that case. I remember another time where a patient came in with just some, mild stomach symptoms, and we tested them with a camera test in the mouth, so an endoscopy. And just for completion's sake, we made sure that we looked at every single corner of it, and we found some small polypoid type things, which can be normal in that area. Like that's a place though where a lot of people wouldn't take biopsies because they're sometimes these polyps are normal. That's just the appearance of tissue in that area. But for one reason or another, we took some biopsies and it came back as cancer, and we discussed having surgery and took out the cancer quite easily just using keyhole. And he was quite young, so it's a win for us when that happens. Um, in terms of missed cancers, we probably don't see our own missed cancers. And unfortunately, I may have missed someone with cancer and I wouldn't know about it because it would have taken years for that to develop, and it's hard to pinpoint one individual that would have missed that cancer. However, we do get patients who come in and they have really widespread cancer, and they would have gone to other health professionals to seek some help, and they would have done some initial tests and said, it's probably okay, and then sent them home. But because it's at its early stages, it's more difficult to detect. And then by the time, once someone's had those tests done and they go home and they say, well, I'm not going to worry about it anymore, then, they leave it for a few years and they realize that, okay, well, actually, it's gone too far. And unfortunately, one of my friends is one of those. One of my friend's wives is one of those people that she had rectal cancer at the age of 30, 30 or 31, and she had bleeding through her back passage, but um, she was pregnant at the time, so she just sort of thought it was hemorrhoids or something, and decided that she'll just, get it checked out after her pregnancy. After pregnancy, obviously, she got busy, and eventually, by the time she made it into the doctor's office and they did all the scans, it was already spread to her liver, and she lived less than 2 years after that, and then she passed away. And it happens, and it's quite sad when that happens, but it's not. That's sort of life. It's some people get lucky and you catch it quite early, and some people unfortunately succumb to the disease. So yeah.
Also, I had one question. This is the first time one of the audience who actually sent me the question previously before this interview started was, I never even heard about this, but he was saying that how reliable are at-home cancer screening tests, which I never heard before. So is that something normal about home cancer screening tests?
I don't have experience with home cancer screening tests.
I think it
e-
might be because of someone who is afraid of getting screened. Um,
mm,
Probably he was trying to ask this question that is there he just asked me that How reliable are
Mm.
cancer screening tests, which I never heard about it.
Um, I haven't heard of them, so I wouldn't comment for or against. However, if you're someone that is looking to diagnose cancer at home, the tests will be less accurate than the tests that you do in a hospital that's delivered by a medical professional. But having said that, there might be a time where all you need is a bit of a mouth swab in the future, and they can get your genetic profile and figure out all the cancers that you are predisposed to. And I think that time is within our lifetime that will happen. So yeah, it's not far. Like there's already lots of progress. The problem currently is costs of delivering such a test because it is an extensive genetic profile that you have to do. But with time, those costs will come down and it'll be more accessible to most people.
That'll be really wonderful waiting for that day.
Yeah.
And also, Dr. Ravi, I would like to ask, what would you like to tell our audience to take away from this conversation regarding cancer prevention and screening?
Yeah, I think the healthier you are is probably the best indicator of how you will do if you have cancer or not. So when a patient comes in to us and we realize that they have cancer, the first question to ask is,
Mhm.
what treatments can this patient tolerate? It's no good if the treatment kills the cancer but kills the patient in the process. So to us, the most important thing is not just number of years or days or months that you'll survive, but what quality of life you're dealing with in that time. If we think that you can get through this cancer treatment, okay, you will have some, reduction in quality of life while you're having these treatments. But, if you're able to get through it, those things will go away, and then you'll have a good quality of life for the rest of it. But if you have heart disease, lung disease, and difficulty climbing up even one set of stairs, or able to walk on flat ground without getting short of breath, if you're generally a sedentary person, all those types of things, your quality of life will only get worse. So with or without treatment, and that makes us quite concerned about offering you anything. So make sure you exercise. Recommendation is 30 minutes at least of cardio work per week. That is not much to ask. That includes a walk every day. Not always that you will get your heart rate up to an intensity that's considered like 30 minutes of a high intensity exercise. But if you keep doing it, your capacity to do it will increase. And don't smoke at all. That's the best thing that you could do for yourself is to not smoke. Moderate the amount of alcohol you drink. Keep a healthy, balanced food and lifestyle. Make sure you're not constipated. That improves your general overall well-being as well. And if these are happening, then the chance that you'll fight anything that comes across your way is much better. So that's probably the best advice I can give.
Wonderful. Thank you so much, Dr. Ravi
No
Vissapragada,
problem.
for that
Yeah.
incredibly insightful discussion. And today we have learned about the critical importance of regular cancer screenings, the role of new technologies, which you mentioned in early detection, and how simply lifestyle changes can reduce our cancer risks. We've also cleared up some common myths today about screening that hold people back, from taking these life-saving steps. For everyone watching today or watching later in the recording, the most important step you can take is to be proactive about your health. If you are due for a cancer screening, whether it's a mammogram, colonoscopy, or any other test, make an appointment with your healthcare provider as soon as possible. Early detection can make all the difference. You can visit our website. We'll be putting our resources down there. Dr. Ravi also will share some resources with that for more information on cancer screenings and prevention strategies. Once again, a huge thank you to Dr. Ravi for sharing your expertise
You're most welcome.
today.
My
Your,
pleasure.
yeah, your insights have certainly made a positive impact, and we did also like to thank all the other people who will be watching this show and for being a part of this important conversation. Your health is your wealth, and we hope you feel empowered to take action after today's discussion. So before wrapping up, I did like to mention that eventually down the lane, we'll have more such virtual talks on health screenings with Dr. Ravi. If there's any particular topic that you would like us to discuss, please let us know. Thank you again. Stay safe, stay healthy, and we hope to see you all soon. Thank you.